This clip is sponsored by Med Travelers. If you're an SLP interested in travel therapy, visit medtravelers.com to get started. Well, and I know you mentioned working with children who are non-speaking.
Mm-hmm.
Who else do you work with, or what other types of children or even adults would be appropriate for AAC? And you can speak to just in general or your practice.
I think I'm really hard pressed, and this is going to sound cliche possibly, but I'm really hard pressed to think of somebody that you couldn't use AAC with. It just kind of depends on the type of AAC that you're talking about. So yes, for non-speaking students, obviously you're going to want to incorporate some kind of AAC to build up that communication for them. But you and I use AAC all day, every day, when we're using our phones and we're texting and we're using emojis and we're writing things down. It's just, when you think of AAC, you can think of it as that broad term. It's really augmentative and alternative. So it's augmentative is the part that a lot of people forget about. But that really goes for people like you and I, or people, students or learners who are already verbal, but just may need a little bit of a supplement. Students with apraxia benefit from AAC. Students with selective mutism can benefit from AAC. Late talkers, anybody that just needs a little bit of help. It's like just learning another language. So, if you think again about another language with, if you were to go to a different country and you didn't understand the language, but if somebody showed you a visual of a word, you'd more likely understand that visual, given that it was something that was familiar to you. But that's another form of AAC, is just having a visual. So I could make an argument that about anybody that I talk to or that I come into contact with has used or is using some form of AAC. It's just dependent upon the type that you're talking about.